Hello dear colleagues, how are you today? I hope you are well. Here we are going to explain another question of cardiology. A 28-year-old man complains of heart racing. He's completely conscious throughout. He has a pulse of 132 beats per minute, a blood pressure of 120 on 70 mm Hg, and a respiratory rate of 21 breaths per minute. An ECG was taken which shows supraventricular tachycardia. What is the single most appropriate immediate management? Okay, here we have a young man complaining of heart racing, but the patient is completely conscious. His pulse rate is 130 beats per minute. As we said, the patient is tachycardic. His blood pressure is 120 on 70 mm Hg. It means that the patient is hemodynamically stable and a respiratory rate of 21 breaths per minute. Okay, here we are going to read the choices. What is the single most appropriate immediate management? A. Amiodarone. B. Adenosine. C. Direct current cardioversion. D. Verapamil. E. Metoprolol. Okay, this shock is not choice here because the patient is a young man and the patient is completely conscious. He is hemodynamically stable. Okay, the best choice here can be adenosine. If we had here the choices like carotid massage or Valsalva maneuver, the best choice would be carotid massage or Valsalva maneuver. But we don't have these choices here. We can choose adenosine, the best choice. Okay, here we are going to explain it. This patient is stable. Treatment of SVT or supraventricular tachycardia in patients who are stable always begins with Valsalva maneuvers followed by carotid massage followed by adenosine if there is no any contraindication for its use. Okay, if the patient has asthma, verapamil would be a better option. If in this patient we had history of asthma, then verapamil is a better option than adenosine. Okay, we must point this note in the exam. If the patient is coming with a supraventricular tachycardia, he is hemodynamically stable, and we have in the choices adenosine, and he has also the history of asthma. And in the choices we have adenosine and verapamil. The verapamil would be a better choice than adenosine. But if the patient has no history of asthma, adenosine is a better choice. Okay, DC cardio work only if the patient is hemodynamically unstable or after receiving 3 doses of adenosine. The patient is still in SVT condition. Okay, after receiving 3 doses of adenosine, or the patient is hemodynamically unstable. For example, the patient has a decreased level of consciousness, the patient is hypotensive, or complaining of chest pain, and then we can use DC shock in this patient. Okay, here we can see an ECG showing supraventricular tachycardia. The heart rate is increased here, and this ECG also we can see supraventricular tachycardia. The rate here we can say it's near 145 to 150. Okay, here was the management of the patients coming with chief complaint of supraventricular tachycardia. Thank you for your attention.